Hey guys, and welcome to today's live stream. We're going to be talking all about the best exercises for your spinal health. Hopefully you guys are going to find this really helpful. And with that being said, let's get into today's topic. So two things to announce before we get into it. First and foremost, if you are new to the channel, please do consider subscribing. We do these live streams every single weekday. We've got Q&A at the end of today as well. So if you are concerned about what exercises you should be doing, why, then please do post those in the comments below and we will get to those questions towards the end of the live stream. Lara's the other side of the computer, so she'll be taking down your questions and we'll be going through the answers at the end. The little announcement just on the side, you might have noticed this over my left shoulder. Many of you guys who are in the Back in Shape know about our winning of the Queen's Award earlier this year. We finally got the trophy, came through this week, so we thought we'd just pop that on the side there just for today's live stream, something we're really proud of. And normally we would have got this during lockdown, but it's taken so long to come. It was something that we were really excited to see. So just the practicalities of what should we be doing, when, why, and what if it's chronic, and what if it's an acute injury, and how can we really move forwards on a principle point of view? Because the reality is, whether it's a slip disc and we've got that MRI finding of a prolapse disc or a posterolateral disc bulge at L4-5 occupying the lateral recess, or whether we've got a broad-based disc bulge, or whether we've got a bit of degenerative disc disease at L5-S1, or a facet arthropathy and hypertrophy at L3-4, or whether we've got ligamentum flavum hypertrophy and some canal stenosis. These principles that we're going to give you in today's live stream, they're going to help you address how we treat those things, because those minutiae of detail generally are important if we're going to chop this bit off or cut that bit off or inject there or in that sort of approach. But when we're talking about rehabilitation, they don't really make too much difference, because you can't practically address your rehab to a microscopic segment or a very small segment of your tissues. We don't have the control, but what we can do is provide stability. And if we understand the problems that our spine can face, then we can really be much more effective with our rehab, and also have that all-important clarity that we're doing the right thing to get the problem resolved for both the short, medium and long term. So very important points there. So first and foremost, our spine bears load, and it fails to bear load when we get an injury. Whether it's compression of the facet joints and irritation of the facet capsule, or whether it's a compression and a slow degradation of that disc resulting in a bulging, herniated disc or something to that degree, it's a bearing of load that has failed. And it's important to bear that in mind, and it most commonly results in symptoms when it affects the discs. And in reality, we cannot bulge a disc, we cannot have compression enough to bulge the disc without some facetal involvement, because the two areas are connected, and that's just the way our body works. It's very difficult. The intricate natures of the way in which the front and back part of the vertebra pre-stress one another with sensors, etc., and reflexes is so integrated. It's very difficult to injure one structure without something else also being affected as well, because those other things must have failed for this structure to become injured specifically. So it's important to bear that in mind, and it is a load-bearing process, and it's a failure of load-bearing that has resulted in that injury. And that's very important in the early stages of our recovery if we're going to get better and not do the wrong things. Second thing is, when we are injured, that very first time we're injured, that 48 to 72 hour window is really important. You'll notice a sweeping arrow around here, which I'll get to a little bit later. That first 48 to 72 hours, very important. And beyond that, we have to recognize what's happening through our body and what's happening in a different what different processes are looking to happen. And then beyond this, we just need to crack on. Beyond that 48 to 72 hour period, we just need to crack on. We need to move on with our rehab. And this is where the realms of chronicity and chronic back pain do start to muddy the water. They make it more difficult for us to really know how to proceed. And with the backdrop of maybe previous failed rehabs and previous failed treatments and things, it can make us very unsure. And that gets us stuck in a cycle of perpetuity where we're just never able to move out of that rut and make the progress that really there's no reason we shouldn't be able to make, especially given the experience that we've had over the years, both with the Back in Shape but also in clinic as well. So that's very important for you guys to bear in mind. So first and foremost, what do? We break things down when we talk about this, and many of you guys in the Back in Shape will know we break it down to phase 1, phase 2 and phase 3, and all those phases have different different characters, different types of exercises, but the principles behind those are really as follows. The first thing is we want to do gentle and safe exercises, not increasing load. I repeat, not increasing load. If we have a disc injury, we do not want to be compressing that poor thing. We don't want to increase strain and shear through those injured structures, and therefore excessive end of range, that's EOR, end of range exercises should not be done. Now, there is no problem if I've got a back injury, doing end of range exercises with my wrist and bending it and so on. That might not necessarily be good for the long term, but doing that is not an issue. As I get to the end of range here, I'm maximally stressing these tissues and compressing these bones, and as I go the other way, the opposite is true. We do not want to be doing that in the lower back. That's very, very important. That being said, when we get sensible, if we're smart, we can do other joints or use other joints through their range of motion, and that's okay. But all too often, we see these aggressive knee hugs trying to pull the lumbar spine into full flexion, or we see the twisting motion. We've all done it. We've all been told them. We've all seen them on YouTube, lying on your back, rocking the legs all the way to one side and all the way to the other to get maximal torsion through that lumbar spine. These things are not sensible, and those of you that have done some of the phase 3 exercises that involve rotation will know when you do it correctly, our spine doesn't rotate all that much in the lumbar spine only. It really doesn't have that much rotation that goes through it. So these knee rocks going from side to side are putting what I would classify as excessive end of range exercise through those joints, and the rationale behind it is to move the area, but there are safer, more sensible ways we can do that, and I'll get to that in a moment. And it's important, of course, to allow for this 48 to 72 hour period, and that's where the right exercises that do not increase load, that do not use end of range, can really, really come in handy. Because in that window after that first injury, our body's trying to formulate a scab or a callus in that area, and it's the appropriate formation of that that's going to allow us to then firstly create granulation, the laydown of new capillaries, which is going to bring nutrients into the injured area, but also the secretion of growth factors and other things which are going to help stimulate the healing and regenerative process. And if we're constantly ripping apart the scab by doing silly exercises that don't make sense, that maybe provide a short-term relief, you're going to interfere with the healing process, and that's not going to be good either. If we're doing some of those exercises, you wouldn't dream of getting your little cut. What's the first thing we do when we have a cut on our hand? We try and close it up and press on it to make sure that it knits up nicely. We don't spend the next 42 hours every time we wake up pulling it apart every morning. We don't do that. And it sounds, common sense when we use that example there, but we sometimes fail to apply that to our lower back injury in the same way. So it really is something you guys need to bear in mind. Avoid those end of range exercises because they're going to pull on the wound and open things out in a way that maybe we don't want to do. And that's very, very important in that early stages of recovery. Now, if you're chronic, that's a little bit different. So we'll touch on that as we go through. If we've got chronic problems, they may fluctuate up and down and the tissue damage may not necessarily be that bad, but that's why we've also formulated the phase 2, which adheres to some of these principles. And before we get in there, one final thing is that doing a little bit of walking and moving around is helpful in a good posture. Bending over, buckling forwards is not going to be helpful for you, so try and get yourself. That's why we've got specific exercises like the towel. We want to protect that area, so learning to re-engage our core. We cannot stress that enough, that learning to re-engage and provide protection for the lower back is so very important. And if the only way you can do that is by doing a sit-up or a pelvic tuck, we have a serious problem because those exercises do not translate to being upright. Doing a pelvic tuck while you're standing serves to directly increase the load on the disc. And if that's the only way you've learned how to engage your core, you're in a very, very sticky situation when it comes to recovering from back pain. The next thing is we do want to share the strain. That's where working sensibly through some of the hip muscles, as we mentioned time and time again, will really help decrease the load that lower back has to go under. And that's a very, very important principle. And finally, as I mentioned just before, basic movement, moving around the house. That's really, really important in this stage of recovery. And as I said, we want to allow that 48 to 72 hour period to go through, maybe doing some of these safer exercises when we first injure our lower back. Very, very important. So then we move on to phase 2. Here there's a few bits and pieces to it. We want to slowly strengthen. We're lying on our back, building on that core engagement and doing some other exercises without the load of gravity through our spine. And quite often people that have more chronic pain here will struggle, and they'll be put off this first part, because when we have chronic back pain, we've often avoided things that maybe should have been done to help us get better faster. So we've lost a bit of that muscle mass, and therefore learning to do some of these exercises off weight bearing, maybe we're moving the legs or whatever it may be with the bridges, etc., we may find that those are difficult because we just don't have the strength. But if we do not have the strength to lie on our back and move one leg without our lower back being forced to move as it overcomes the competence of our core, then we are really going to struggle when we're upright doing the dishwasher. And we get people all the time saying, well, not all the time, but we get people from time to time saying, I can't do the phase 2 exercises. I've got to wait and get fitter, or I've got to wait and get more healthy, or I've got to wait till it calms down, or I've got to wait for this, that, the other. And you think, yeah, Bosher, maybe you've got a bit of help, but you're still doing all these things that are terrible, absolutely terrible. Yet those specific exercises, we're not willing to do those. And it's really important that we must do those exercises. Now, there are ways we can break some of these exercises down into their constituent elements to make them a little bit easier to transition into. And that's a conversation. But if we just back off and don't do any of these exercises, we'll be stuck in this phase in perpetuity. And the real dilemma here that affects so many is that they are stuck in this phase in perpetuity. They're doing exercises that aren't doing anything to deal with the problem, but they feel nice when they do them, or they help in that respect. But no underlying strength has been built. So you go out, walk the dog, pulls you a little bit, all of a sudden your back's sore again, you're back to square one, because we haven't built any strength. We have to move into this phase. And the great news is every single one of you watching this video, bar none, because we've seen some people in a lot of trouble in the clinic over the years, will have the capacity to do it. It's just maybe there's a little bit more hand holding required, a little bit more work to make sure that our technique is not failing to get into the nitty gritty of phase 2. Now, a lot of these exercises are off weight bearing, so we don't have the complication of gravity, which is going to add that initial load straight away of the whole of our body weight, or upper half of our body, on our spine, and that's going to create trouble or create challenge. So these are very safe, they're off weight bearing. We maybe have one or two which are on weight bearing, but very, very simple and very, very stable positions, which translate some of the skills we've learned off to on weight bearing. But we're still not doing any of these end of range exercises. That's very, very important. I've already covered in terms of I'm too sore and I can't do this exercise. Unless you are really stuck in bed, and you have been stuck in bed for a long period of time and not able to get out of the house, I really would say that we need to move on to these exercises. And to be completely frank, if you are stuck in bed and it's been going on for a long period of time, I would hope that you've been investigated effectively through MRI, X-rays, whatever it may be, and been given some more support, because sometimes we do need to just get those images done and figure out exactly what's going on. We shouldn't be stuck in bed for weeks and months on end, not sports such as osteopaths, physios and chiropractors. No one will recommend that, so please don't make that mistake. It's a very, very difficult one to climb out of afterwards, but possible, just challenging. And then finally, build up your movement and stability while we're upright. We want to build these things up, and this takes time. Sometimes people will go through these sorts of exercises and be able to progress through them in a matter of weeks. Others will take a couple months longer. Maybe it takes them 2 or 3 months to build through these exercises and get stronger. But we need to provide stability without moving the spine in any major way. We want to provide the ability for those core muscles to hold that spine steady as we're moving. And these are the exercises that promote the healing and ultimately promote the spinal health. And finally, once we're at a point where we're stronger through that core and we can hold things steady, we can start moving into resistance-based exercises to further challenge that system. And really, it's only when we start moving thoroughly through the resistance-based exercises, we would put that into the phase 3 of rehabilitation. It's only when we're in that final phase that we're starting to get somewhere that resembles a normal level of strength and stability that's acceptable. And to the degree that we have other spinal degenerative issues or injuries, etc., things that we cannot completely undo, dictates how far along we need to push that. The more anomalies we have in our spine, maybe we've got some degenerative disc disease, maybe we've got some facet hypertrophy, we can't shave the bone off, it's there. The structure's a little bit weaker than it otherwise should be. To the degree that is the case, we must provide a little bit more stability through the muscles and maintain that through the muscles for longer. And that's what will keep us really, quote unquote, back in shape for good. So that's really pretty much it from me in terms of spine health. Hopefully that's taking you through the whole process, and we'll go over to Q&A.
Okay, good morning.
And I'm going to get a drink.
Okay, good morning, everybody. Please do keep your questions coming through. And thank you so much for the kind words regarding the Queen's Award. We were thrilled to receive it.
That's awesome.
Right, let's get straight into questions. So Mandy has asked here, if you've been doing all the wrong things as advised to for years, knee hugs, child's pose, etc., is it going to take years?
But it does take a good couple of months to really make some progress in the early days. You're going to be a lot safer. I know Mandy's mentioned the other day online about getting a bit of a flare up, but it just kind of goes very, very quickly, and that is really moving towards what I'd consider sort of normal, if that makes sense. But it doesn't necessarily take years to undo that practice, but it does take a little bit longer the longer we have had these problems. It's a bit of a wishy-washy answer, I'm sorry, but I wish I could be more specific. But it doesn't take as long to build it back up in many cases as it does when we've been doing the wrong things for extended periods.
Yeah, and Mandy has made such great improvement as well in such a short space of time, which is wonderful. Sally has asked here, she did say she's going to book in that virtual with you, but she had her x-rays, images done. So she said, saw the chiro yesterday, assessed me and did the imaging. I was, that I'll be able to share with you, told that I present in a capitalised way, weight through heels, right hip hike forward, left shoulder hike, muscles on the right lumbar pronounced and hanging on, etc., etc. I get to discuss imaging and suggested treatment plan next week. So this is a question. So as I work through phase 3, how would my contorted body correct? Clearly, being like this is putting pressure, load, etc. in an appropriate way. And then she just says that she'll discuss it with you in great detail on the virtual, and she'll send over the images. But a very good question. Yeah,
so when they're talking a lot about these sorts of things, sometimes, and this really ties in, I'm not necessarily saying, Sally, in your case, you've got this, but if we've got scoliosis, it really ties in the same sort of way. Now, the important thing we have to consider is when we've got these sort of issues, they're talking about one hip higher, one shoulder higher, etc. It's generally speaking going to be something to do with the fact that our spines may be, and this is an over-exaggeration, so please don't take this as reality, Sally, but the general gist is really quite important. I think this will benefit a lot of people that do have maybe some more severe scoliosis. We've got the one hip coming up, we've got a bit of a leaning to one side, which is going to make muscle bulk on this side appear a little bit larger. Sometimes it is the appearance of the muscle being larger. Like if I have my elbow here, it doesn't appear that bony, but if I do that, it sticks out loads. So we've discussed that with the neck bones as well. Sometimes when we have these torsions through the spine, they can actually make the muscles appear larger, but actually they're just pushed out more. So that's worth bearing in mind also. But essentially, what we're trying to do is, this is a bag of potatoes, as I've mentioned before. I'm not saying you're a bag of potatoes, but it is. And if we provide more stability through here to that sac, it holds everything straighter. Now, it's not necessarily going to push you back to the middle and square everything out completely, but that underlying tension through the system helps oppose gravity, because gravity is acting on you every single day. It's putting that downward force. And the problem with these left to right imbalances is once they play in, the spine should be straight here. So the compression through the spine is dealt with from the curves that we see from the side. We know from the side, our spine should be like that. So the curves from the side allow us to deal with gravity effectively and load, etc. And when we're straight from the front, it focuses on those curves from the side. But as soon as we start to get a left to right imbalance here, the load of gravity does make this sort of thing a sort of positive loop, which is not a good thing. It means that the pressure of gravity makes these curves enhance, which creates issues. So really the main thing we need to do here is provide more and more stability to compress and oppose that gravity on a daily basis, and that's what helps square things out. Now, there could be that there are some issues with the foot, with the leg lengths, which can make this a bit more challenging, and that's just the way we've developed, and that will have been like that since you were 12, 13, 14, 15 years of age. So it's not necessarily that it's a massive issue because we haven't had a problem since then, but it is something that we need to consider when we do end up injuring the back. If we injure the back and we are in this position because one leg is longer than the other, then we are going to have some extra challenges, and we're going to need to have a little bit more core stability. And I think, if I remember correctly, I could be wrong here, Sally, so do correct me, things like the lunges start to reveal a little bit of issue in these glute muscles that maybe they're not as strong as they otherwise need to be. So I think that answer the question.
Yeah, that's great, and I think you'll be able to give her so much more detail.
Yeah, we'll be able to go through tons of detail. Do ping those images across to us. Really to the clinic email address would be best.
Okay, awesome. Right, Alex says, did someone mention phase 3 alternative exercise? Are those in the bonus section?
I commented referring to the workout number 2. the one with hip hinges, etc. So those, we haven't got any sort of additional exercises just yet, but I did mention a little bit in the comment to you about looking to add in some new workouts in the future. We've just got a lot of things on at the moment, which we'll be announcing probably over the next week or two. And once that's out the way, in a good way, we'll be able to start adding in some of those other things as well.
Yeah, absolutely. Lots of exciting things to come. Kieran has asked here, do you need to have a diagnosis to work through the problem, or can you start these exercises without going through that process?
Yeah, this is the one thing that really, really bothers me, because I've mentioned it before. The best time to plant a tree was 20 years ago. The second best time is today. All too often, people will say, I need my diagnosis. I need my diagnosis because I don't know what's going on. But I walked to the hospital, I got in the car, I got out of the car, I emptied the dishwasher yesterday morning, I did the dishwashers, I made the sheets, I maybe struggled through these things, but was willing to do them in spite of having an unknown diagnosis. Now, rationally, I've really struggled with that, because you're willing to do all of these things that objectively are wrong. But you can't injure your back if you do these things correctly that we recommend in the Back in Shape, because your back's not moving. Yet we're willing to do all of these other things on a daily basis. And this is a bit of a rant, because it's what happens is we don't do this. And unfortunately, because of maybe some of the overloading of the NHS at current times, things are being put off for extended periods. An acute problem can turn into a chronic problem. And it's so much easier to deal with these things sooner rather than later. But waiting for 6 weeks for a diagnosis for an MRI that's due then, knowing from experience, is not going to change things. We're not getting you guys in that phase 1 of Back in Shape or the phase 2 of Back in Shape to do cartwheels or to do backflips or anything like that. They're very sensible, safe exercises, and the need for a diagnosis invariably doesn't really change anything. It helps you understand the problem, which I think is so valuable. It's so valuable. But to put off doing some sensible things while still living your life, albeit in pain, really doesn't hold water when we break it down. And it's a real shame, because it means that you've basically wasted a couple of weeks to a couple of months and allowed yourself to get worse. And then again, a lot of these times we're doing the wrong things unwittingly, and then it makes it harder to climb out of that hole. So then the expectation is, well, I want to get better now because I know what's wrong. And it's, well, I'm sorry, but you've left it for this long. And we've seen this in the past with patients in the clinic where they maybe, I've got to come in, and then it just hasn't fit in the diary. And then we see things and we're like, man, if we'd started this long ago, it would have been so much better for the outcome. It really is the case.
Brilliant. Alex Vesco agrees with you. He said so true. Thumbs up.
Yeah.
Ollie commented here. He said, when first getting out of bed in the morning, what can we do to make our back feel less stiff first thing?
The natural mechanisms in our back is that our discs hydrate, and if we go overnight, we've got the discs in the lower back which are going to overhydrate. Now maybe there's some issues there. We've got some degenerative change, so this can be a little bit dysfunctional, this process, which is problematic. But the disc, you went to bed like that and the disc was that big, and then there's the bones and the muscles attaching over here, and then you wake up in the morning and the disc is now a little bit larger, okay, because we lose height during the day. So what's just happened overnight is the muscles have been stretched out. More tension's been put on the muscles a little bit as the discs have inflated off weight bearing. So then we go and stand up, and all of a sudden everything's a little bit more stiff because there's more fluid in those discs, and that's when it's very vulnerable for injuries. Bending down, touch your toes, put the sock on, boom, it goes, because everything's held taut, and that can be problematic, and that's why people so frequently injure themselves first thing in the morning. The best thing to do is to keep a neutral spine, to avoid bending earlier on in the morning, not to do the things that are often recommended, which is hug your knees, etc., but to get up, get out of bed in a proper way. We don't bend forwards, we don't round our back. Pop on some slippers, not your socks. Don't change your underwear or lower half clothes, your pajamas. Just leave your pajamas on, put a dressing gown on, or whatever the case may be. Go downstairs and make your breakfast or do whatever. Don't go into the bathroom and have a shave and do all those bending forwards movements. Just for the first 10 or 15 minutes, leave the bedroom and go and do something upright around for a little bit. It might be, making your coffee or making your breakfast, but in an upright position. What you'll then find is that very quickly will settle this disc down back to sort of normal, and then you're going to feel a lot looser and able to go through those other activities in a safer way. It makes a massive difference, but people just don't do that because we're creatures of habit. If we've done it all our life, we do it all our life. Get up, do this, do that, do that. Change it up, do what I've said. get out of bed, don't do any bending, go down to the kitchen and do whatever you want to do in there in an upright position. And after 10-15 minutes, you're going to find it's a lot easier to do those other tasks with a lot less pain. Or
awesome.
stiffness. It's not pain, it's stiffness.
Really interesting comment here from Sally. She said, yes, thanks. Getting stronger with the lunges slowly. The chiro suggested rehab is working wrong muscles. Until I'm sorted, there's not a lot of point. Okay. Shocked face. I'm going to ignore that because the chiro doesn't know exactly what I'm doing in the back and shape. I'm really surprised by that comment.
So it's running from a philosophical point of view. The chiropractor will say, well, I've got to put the bones back first. We've got to do a few adjustments. These joints are stiff, those joints are stiff, etc., etc., etc. And I would just disagree with that. Having done that, I've done all those things in the past. With regards to that sort of comment, they're talking about, oh, some of these joints need adjusting, etc., etc., and there's no point doing it until after. And that's really that's their philosophy. That's the philosophy under which they're operating. So you have to bear that in mind, and maybe they don't necessarily appreciate where you've come from in the back and shape exercises. So that might be why.
Okay. Alex said, astonishing, my NHS physio told me to knee hug and rock from side to side first thing in the morning to loosen up.
Yeah.
I think that's actually the guidance on the NHS.
Yeah, no, it is the guidance. Because what that's doing is the knee hug is directly compressing the disc, so it's really squashing out that excess fluid, and therefore that's what happens there. But do we want to be that aggressive? Maybe not. Maybe we don't want to be that aggressive. Maybe we don't want to focus all of the fluid coming out the back of the vertebra, because if you squash the donut on the front, the jam goes out the back. Whereas if we just compress down a little bit, it's going to soak that up a little bit better. We won't end up getting any major issues with regards to that. So I would say that it's just too aggressive. It really is too aggressive, and it's misguided in my opinion.
Awesome. Jeannie said, I do the phase 1 exercises before I get out of bed, and it seems to help with the stiffness.
Yeah, I know a lot of people find their phase 1 because you're loosening up your hamstrings. But you have to remember, everything's been still for the night. Your muscles are not. They don't like being still for extended periods, and actually just going through those phase 1 routines, especially with the leg work, and just waking up the core as well, so it's a little bit more primed and ready to go, is going to be a helpful thing. And I know a lot of members do find it useful to do that phase 1 first thing in the morning. Just tentatively.
Kate's also asked, with the towel first thing in the morning, first thing in the morning, get you going.
I think it's an okay one to try to do, but I do think shimmy just gets things moving first. So if you wake up on your back, you shimmy your bum left and right, not twisting, just a gentle left and right movement. And all that's doing symmetrically, without the load of gravity, is just putting a little bit of a tilt through here. And that works really, really nicely. It wakes up all the muscles, it wakes up the discs and all that sort of stuff in there, gets things moving a little bit, and then we can safely roll over. We don't want to do that. And also, if we have woken up a little bit twisted for whatever reason, it just helps us reset in the safest possible position. Side bends, which is what a shimmy is, bending left and right like so, in a neutral plane, is really one of the safest exercises that we can do, especially off weight bearing.
Okay, also on YouTube, I hope I pronounced this right, Bravia asked, can you perform the exercises, make a video on the exercises? I have just sent you a link where you can sign up for free to the Back in Shape program.
Yeah, all of these phase 1 exercises that we talk about are all on the Back in Shape. I mean, that's on the YouTube channel as well. They're all in the phase 1 part of the program, which is easy to join.
Okay, brilliant. I think that's everything for today. Awesome. Thanks everybody for the questions. Great session.
Well, thanks so much for joining us, guys, and thank you for the questions. They're really, really appreciated, and hopefully the answers, especially like little ones that maybe aren't directly related to this, can really help you guys get a better, more full understanding. And Sally's question in particular about other comments from other practitioners can also be helpful in understanding why they're saying what they're saying, and they're operating maybe from a different standpoint. And it's for you as a patient as well to decide what makes the most sense to me and what can help me understand their thinking so that I can make an informed decision. And that's really, really important for anything, whether it's back related or whether it's other health related or whether it's just general advice and guidance on all sorts of different things. We want you guys to understand as best as possible from a layperson point of view what's going on and why we're doing these things. And I'm going to put this away now so I don't drop it and break it. But thanks so much for joining us, guys. Have a great afternoon, and we will see you tomorrow with another live stream. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.